so far this year in Louisiana after being infected with a flesh-eating bacteria. We're joined now by our med team doctor and infectious disease specialist, Dr. Ed Dominguez. Dr. Ed, it is always a pleasure, sir. All right, let's start with this question. What exactly is that bacteria? Where is it encountered, and how can people stay safe?
The bacteria is called Vibrio vulnificus, and it's a very common coastal bacteria that's found in the brackish waters around the coast, the Gulf Coast. This is water that's a mixture of warm seawater and fresh water, and the people that are most at risk for this are going to be people, Jennifer, who have open wounds, who go in there with a completely open wound, not covered up, and get it very wet and possibly infected. People with underlying immune deficiencies like liver disease, kidney disease, taking immune suppressing medications are the most at risk. If you get wounded while you're in the water, you need to get out promptly and wash it off with soap and water. As you've heard, it can be a deadly infection.
And that's a good tip there. Just take care of it. A new study from the American Heart Association shows millions of Americans with untreated high blood pressure might now need medication. That makes sense, right? Dr. Ed, why is this medication being recommended now, and who would benefit the most?
Well, it's being recommended now to save lives. With this new recommendation lowering the blood pressure where we treat people, we've added roughly about 30 million people who might be eligible for therapy. And if we treat those 30 million people, we can decrease the number of deaths, we estimate, by between 20 to 30,000 per year. So a big, big move. Now, the important thing is who's the most at risk. It's going to be, again, our diabetics. People with diabetes and high blood pressure seem to have among the highest risks for cardiovascular disease, and by targeting them for high blood pressure therapy, we can save possibly even more lives.
Be proactive, get those yearly exams. Dr. Ed, a new study from the American College of Cardiology shows abdominal fat might be a better predictor of heart disease than the body mass index, also known the BMI. Why do researchers say that fat can be more accurate, and what are some of the best ways that we can reduce our chances of disease?
You know, the abdominal fat that we can see around the waist and using the hip to waist ratio, that fat is an indicator of the inside fat that we can't see, what's called the visceral fat, Jennifer. And that fat it correlates much better with the risk for cardiovascular disease than the BMI does. Now, the important thing here is what can we do to decrease that? Well, it's not an easy thing to do. It's lifestyle changes over time, improved diet by decreasing the amount of saturated fat and sugar we eat, decreasing our alcohol intake, exercising more, getting better sleep, decreasing our our stress. By doing all of those things, you can possibly prolong your life, but it takes time.
All right, Dr. Ed, a good lifestyle change. Our thanks to you for joining us today, sir. The groundbreaking